Thank you so much for joining us today for our Youth and Young Adult Vaping Behaviors from Research to Practice webinar. I'm Leslie James. I'm the Senior Manager of Health Policy with Heart and Stroke, and I'll be moderating today's webinar. We're very grateful for all of you for taking the time out of your busy schedules to be with us today on this important issue to discuss the youth vaping crisis in Canada. So here's an overview of our time today. To start, I'll be addressing why Heart and Stroke has funded this research project and what we've done in the area of youth vaping to date. We'll then position ourselves with the learning objectives and then jump into the presentations, which will be followed by an opportunity for group discussion. So Heart and Stroke has been involved in the youth vaping file since 2014, when we were the first organization to put out a public position statement on the subject. Then in 2018, when vapes with nicotine were first legalized in Canada, we testified before Parliament asking for stronger safety standards and also measures to prevent further youth uptake. Now, since legalization in 2018, we've continually updated our position and policy recommendations based on the emerging evidence. But we've been continually focused on the accelerating youth uptake rates. We're concerned that youth vaping could undermine the decades of progress made in tobacco control. And we're also concerned about a new generation of young people becoming addicted to nicotine. We're also closely monitoring the emerging research that shows a link between vape use and increased risk of cardiovascular disease. And over the past few years, we've worked closely with partners and governments to introduce measures that will address the youth vaping crisis. So in addition to the strong leadership we've seen provincially and territorially, with vape restrictions like flavors, taxation, nicotine caps, and moving age of purchase to 21, we were very pleased to see our recommendations around banning marketing and promotion visible to minors implemented at the federal level. So as you can see in these photos, before the federal regulations, when vapes were first legalized in Canada, we saw advertising for these products everywhere. It was clearly targeting young people, and you saw ads everywhere and anywhere, including highly public and highly trafficked areas like subway stations across the country. And while there has been a lot of momentum and progress to date, there is still a lot of work ahead of us. And that's why Heart and Stroke is excited to share with you the latest results of the pan-Canadian research entitled Youth and Young Adult Vaping, a project funded by Heart and Stroke and conducted by Dr. Al-Hamdani. We're also honored to have with us today a clinical leader in youth addiction, Dr. Chadi. Dr. Al-Hamdani's research will help us understand behaviors, motivations, and preferences among young vapers in Canada. We'll then talk about the controversies that exist around vaping more broadly and try to find some clarity for policy development. Then Dr. Chadi will give us an update on the health risks associated with youth vaping. And lastly, we'll discuss future policy opportunities and advocacy initiatives that can help address the issue. So it's my great pleasure and honor to introduce Dr. Mohammed Al-Hamdani, who completed a Nova Scotia Health Research Foundation Fellowship in 2017, and a MyTax Elevate postdoctoral fellowship with the Department of Psychology and Neuroscience at Dalhousie University. In 2019, he was recognized as the country's most outstanding MyTax Elevate postdoctorate fellow for innovation, adding to his past leadership, academic, and humanitarian awards. Dr. Al-Hamdani has years of progressive management experience and currently serves as the Director of Health Initiatives for the Lung Association of Nova Scotia and the Executive Director of Smoke Free Nova Scotia. His work in tobacco, cannabis, and vaping control has directly impacted very effective policy change in Nova Scotia and across the country, and we're honored to have him with us today. Dr. Al-Hamdani, over to you.
Thank you, Leslie. Appreciate the thoughtful introduction. Hello, everyone. I'm going to flip through the presentation fairly quickly, but there will be an opportunity to ask questions at the end. So just for disclosure, this research was again funded through the Heart and Stroke Foundation and some provincial affiliates, including the Manitoba Lung Association, New Brunswick Anti-Tobacco Coalition, PEI Tobacco Reduction, Anti-Tobacco Reduction Organization, and Canadian Cancer Society as well. And I'm affiliated with non-for-profits with, as mentioned, with the Lung Association and Smoke Free Nova Scotia. So youth and young adult vaping is an epidemic, and this is what prompted us as Smoke Free Nova Scotia and the Lung Association to conduct the 2019 Youth and Young Adult Vaping Project in the province. We wanted to understand the drivers for vaping and the experiences of youth, as well as their patterns when they're vaping these products. 5 recommendations were yielded from the survey, and those are flavor bans and nicotine caps, the need for taxation, stronger enforcement at the store level, increasing the minimum age for vaping to 21, and increasing awareness about the link between vaping and smoking initiation. Because of the success we had in the province, we decided to expand the project with support from the Heart and Stroke Foundation of Canada, and we reached the entire country essentially when we're talking about provinces. We pilot tested the survey with 10 participants, and then we ran the cross-sectional survey with 16 to 24-year-olds. All of them were regular vapers, meaning that they vaped at least once a week, every week for the past 3 months, and they resided in one of the 10 provinces. Just over 3,000 participants from the entire survey, and that included the 500 previously collected from Nova Scotia in 2019. They were recruited through social media, including Instagram and Facebook ads, and completed the survey through a Qualtrics link. We tapped into demographics, types of behaviors, product preferences, and experiences. There was a prize draw for anyone who participated in the survey, as well as an added incentive for completing the survey. And we conducted regional and age, as well as gender comparisons. The mean age of the demographics was about 18.63 years, an equal division of youth versus young adults, and almost equal gender division for males versus females. Most were employed and lived in urban areas. The age of onset for vaping is 15.79 years. Just over half of the participants engaged in a serious quit attempt that lasted over 24 hours. And the average number of quit attempts is about 4. When we're looking at how youth and young adults vaped before versus during COVID, we see that it went down from 6 to 5 days per week, and down from 30 times per day to 23 times per day. That's the number of times they take it out of their pocket, purse, backpack, or wherever it's stored. And then every time they take it out, they engaged in 6 puffs per episode. And that number didn't change specifically. As far as spending, it was about $17. The strongest influence to start vaping was friends, followed by smoking cessation and social media exposure, but friends is very dominant, as you can see from the slide. There was a lot of sharing behavior, and the average number of people that they shared their vaping device with was about 20. Most used pod-based devices, and around 2.6 pods per week. About half of the participants experienced negative side effects. 30% of youth suggested that they were pressured to vape, and over half of the youth participants in the sample suggested that their parents knew that they vaped. Top social media exposure platforms are Instagram, Snapchat, and YouTube. Male young adults engaged in the highest number of quit attempts, but they also vaped to the highest number number of days per week, and highest number of episodes per day. And in terms of puffs per episode, female youth were the group that engaged in the highest number of puffs. During COVID, the highest number of days, the lowest number of days vaped were for female youth, so were the episodes per day. And the lowest puffs per episode were for male young adults. Young adults of both genders spent more on vaping in comparison to their youth counterparts. And female youth suggested that the strongest influence for them to start vaping were friends, and for male young adults, that was smoking cessation. Youth reported more sharing behavior than young adults, and also higher levels of exposure to ads on both on social media and other platforms in comparison to adults. And female youth reported the highest number of, or the highest percentage of side effects that ranged from respiratory to gastrointestinal effects. The days vaped per week and episodes per day were highest in the prairies, and the highest number of puffs per episode were in Nova Scotia. Since learning about COVID, Ontario experienced the most reduction in days per week, and in the prairies it was episodes per day, and in BC was the puffs per episode. Spending per week was the lowest in BC and highest in New Brunswick. Flavors are very important at initiation and at present, as seen from the very high percentage of participants that prefer them, and 44.5% of them said that they would stop vaping if you were to remove flavors. 18.1% only added content to their e-juice. Nicotine e-juice was the most popular, and the most popular nicotine concentration was 50 to 60 milligrams per ml. This is just a slide that demonstrates the top flavors that are chosen by youth and young adults. You can see that it's berries, followed by mint and menthol, then mango, then confectionery, and that's both at initiation and at present. The trend didn't change. The only thing that changes is you would see a slight increase in the preference of mint and menthol between initiation and present. And what this slide also demonstrates is how youth and young adults prefer tobacco much less than the other top flavors displayed on the screen. And although I've mentioned it just for a visual, look at how many youth and young adults opt for 50 to 60 milligrams per ml. This is very concerning. Female youth demonstrated the highest preference for flavors, and female youth and young adults also used had a higher percentage of users of flavored products at initiation. Female young adults reported the highest percentage of not continuing to vape in the absence of flavors, and male and female youth reported higher nicotine concentration use in comparison to young adults, particularly for 50 to 60 milligrams per ml. And although young adults used higher nicotine concentration, nicotine-based product, a high percentage of them used nicotine-based products at the onset in comparison to youth, there was almost no difference once they maintained the behavior. Respondents in Newfoundland reported the highest percentage of not vaping if we were to remove flavors, and PI in Nova Scotia and Ontario particularly reported high percentage of users that used 50 to 60 milligrams per ml of nicotine concentration. The one point that I want you to take a look at on this slide is the 27.1% of those with a history of tobacco use that began smoking after vaping, which is consistent with past research. And the one that I want you to take a look at here on this slide is the third bullet point, demonstrating that male and female youth are particularly more prone to starting to smoke after vaping in comparison to young adults. Those are the 16 to 18-year-olds versus the 19 to 24-year-olds. This slide here displays also some provinces that tend to have vapors that also use other products in a particularly distinctive way. For example, Newfoundland has the highest smoking rate per week in comparison to other provinces, and New Brunswick had the highest users of cannabis. Prairie's had the highest percentage of users that were moderate alcohol drinkers. Just for the sake of time, I'll quickly go through the discussion. There are regional differences in vaping frequency that suggest that we need different levels of vaping cessation. The changes in vaping frequency in different provinces suggest differences due to socioeconomic status and more awareness, particularly in a couple of provinces like BC and Ontario. And the 5 recommendations that we suggested for Nova Scotia remained essentially the same, which is to increase the minimum age, have nicotine concentration caps, flavor bans, taxation, and social marketing campaigns. And so in conclusion, we really need to implement the same policies that we implemented in Nova Scotia, and also the ones that are recommended yet not implemented in Nova Scotia. And we also need to pay attention to this red alert state for youth and young adult vaping. And I'd like, of course, to again thank Heart and Stroke Foundation for funding the project, as well as the other funders that was mentioned previously. Thank you.
Thanks very much, Dr. Al-Hamdani, for your presentation. Very insightful and useful information as we figure out what comes next in terms of policy. I'm honored to introduce our next speaker. Dr. Nicholas Chadi is a pediatrician specialized in adolescent addiction medicine. He is currently a clinical scientist at Université of Montréal and holds an appointment at Sainte-Justine University Hospital Center also. Dr. Chadi completed medical school and residency training in Montreal and Toronto, where he also completed a fellowship in global journalism. He also obtained a master's in public health at Harvard University and was the first pediatrician in North America to complete a pediatric addiction medicine fellowship at Boston Children's Hospital, the top children's hospital in North America. His research focuses primarily on the prevention and treatment of nicotine and cannabis use among adolescents and young adults. Over to you.
All right, thank you, Leslie. Hi, everyone. Thank you for being here today. Let's just dive right in. I have no significant disclosures related to today's talk. All right. So just a very quick history of vaping devices and how they've evolved through time. I think it's always helpful to keep in mind how recent and how new vaping is in the history of substance use behavior. So when e-cigarettes first came about, they looked a lot like traditional cigarettes, but were disposable and were made of plastic. And those came towards the end of the 90s. And some of you may remember the first pen-like devices that came a little bit later, followed by those big tank-like devices, the 3rd generation, that could leave out this big plume of smoke. And recently, we've been seeing a lot more of this 4th generation pod-based devices that are particularly popular among youth, as mentioned by my colleague. And we're in this era still, but some of the disposable e-cigarettes are coming back, and some commercial brands you might recognize include puff bars. So, you know, e-cigarettes are in flux in how they look like, but they've evolved like this, and not to mix e-cigarettes or vaping devices with the heat not burn devices that are really meant to be smoking cessation tools and that are not very popular among young people. The difference being that e-cigarettes have a liquid that contains nicotine salts, especially in those later generations, versus the heat not burn devices that heat up tobacco just under the point of combustion and provide sort of an in-between in terms of emissions between traditional cigarettes and e-cigarettes. All right. So zooming in on the pod-based devices, so we know that the technology innovation there really comes from the fact that these nicotine salts found in most of those pods. So very rarely do young people use nicotine or e-cigarette pods that do not contain nicotine, and that nicotine is very highly absorbable. So the experience of consuming nicotine looks somewhat different from using a traditional cigarette that is more irritant versus the softer kind of experience and then very often flavored experience of using a pod-based device. So as mentioned by Dr. Al-Hamdani, typical pods can contain a concentration of nicotine that goes anywhere from 50 to 60 milligrams per ml, down low to 0 to 15, but most of the time we're at the higher end of the spectrum. And if we convert that to the equivalent in cigarettes, traditional cigarettes, we can see that one of those tiny little pods, 1 or 2 milliliters of liquid, can contain the equivalent of 1, 2, and sometimes even more packs of cigarettes. And yes, these flavors are definitely part of the appeal for young people. So what are the substances that we find in this aerosol, this kind of smoke that comes out of the vaping device? So it's still very common for young people to think that it's just water vapor, which is clearly not true. And this schematic here from the Centers for Disease Control just shows us that it's a very big mix of, yes, some sort of a vapor. If it's a nicotine-based e-cigarette, it's usually water-based, so some water vapor, but then mixed with a bunch of flavors or chemical agents that give the flavor, traces of heavy metals, not unlike what we can find in traditional cigarettes. In most of the cases, I mentioned nicotine or THC, if we're talking about vaping cannabis-based products. And so you can see that, no, this isn't just water vapor, and there are chemicals that we wouldn't want to find in a young person's lung. And I think the debate is still very much out there, how we can compare the concentration of these chemicals in the vaping aerosol versus in the smoke of a traditional cigarette. And I mentioned marijuana, and this is definitely becoming more and more prevalent among young people. So we think that about 1/3 to 1/2 of all young people have that use e-cigarettes or vaping devices have used one that contains cannabis. So it's becoming a more frequent way of consuming cannabis. Usually these cannabis vaping products are high in THC, so they have a very concentrated content, a term that is often used to refer to vaping cannabis or THC is dab pens or vaporizers. And really we're talking about a new way of consuming cannabis that is, again, very concentrated, not unlike the nicotine concentrations. So I'll focus on some of the acute and longer term health risks that we've identified and that we're still trying to understand better when it comes to vaping and vaping aerosols. So first, looking at acute harms. So I've been quite involved with some national level research looking at acute injuries tied to the use of vaping device in young people across the country. So in 2019, I was in charge of this survey that was sent out to almost all of the pediatricians in Canada, and 88 severe vaping-related injuries were reported, meaning that young people came to medical care, many of them were hospitalized or went to the intensive care unit because of injuries that were either due to the inhalation of a vaping aerosol, so they were using it, quote unquote, as it's made to be used. And then there were 13 young people that had injuries or illnesses related to drinking or ingesting the liquid. And so I mentioned here the most frequent symptoms, respiratory distress or lung injury, and then some others include nicotine toxicity or gastrointestinal symptoms, central nervous system depression, and some burns. And for outcomes, some, as I mentioned, went to severe presentations requiring ICU admissions, and some had ongoing health issues. So that's not benign. And we are conducting ongoing research on this through a survey that is currently being sent out every month to pediatricians across Canada. So some of you may wonder, well, okay, how does this survey include what we were talking about just before COVID hit, these acute vaping associated lung injuries, VALI or EVALI, the term that's used in the US? Well, so you might remember the headlines about people getting very, very sick after vaping, some very intense lung injuries, and I put the kind of diagnostic criteria here just for your reference. It seems that many of those cases, or almost most of those cases in the US, of course, were due to cannabis containing vapes and the vitamin E acetate agent that was put in many of those products that were bought on the black market. So you can see that there were almost 3,000 cases that were hospitalized of adults and young people in the US, much fewer here in Canada. So 20 cases meeting this definition and only 5 youth. So it's clear that some of these people were mostly using cannabis vapes, some were using only nicotine vapes, and that there are probably different chemical agents in the aerosol that can lead to such a severe picture of lung injury. So we'll need to continue looking at this. We've identified vitamin E acetate as a potential agent, but there are definitely some more that need to be uncovered. So I mentioned nicotine toxicity. This is something that I see in my practice. Young people will sometimes use nicotine vapes as sort of a party drug and try to get as much of the head rush or the euphoria that you can get from using it, and using a lot of it in very little time. And this will sometimes go all the way to causing a picture of nicotine toxicity. And so this will include symptoms like stomach pain, headaches, dizziness, or decreased concentration, and it can last several hours, sometimes bringing youth to consult medical attention and come to hospital. We're also hearing about young children ingesting, as I mentioned, e-cigarette liquids, and caution has been raised. So this is an article from south of the border where cases were reported in the US of young people drinking liquids coming in little bottles that may look like candy or sweet products. So this is something that is also still on the radar for pediatricians and young people in Canada, so ingestion injuries. So I get a lot of questions about secondhand aerosols. We know more and more about secondhand smoke and how that's harmful. There is emerging research showing that there is probably some level of risk with secondhand aerosols based on the fact that they contain all sorts of different chemicals and small particles. And there isn't really a consensus on how can you compare. I mentioned we're still not sure how we can compare the primary inhalation of vaping devices versus the primary inhalation of smoking cigarettes. You know, you'll hear numbers like 95% cleaner or healthier than traditional cigarettes in the UK, but really it very much depends on how much you're using of the vaping device and how close you are exposed to that aerosol. And so that becomes very true for secondhand aerosols. So if you're breathing that aerosol from very close, then there's likely to be a lot more of those small particles coming into the lungs. And so because the aerosols of the vaping devices typically contain smaller sized particles, they could potentially go deeper into the lungs and get stuck there. So with a bigger absorption capacity. So we need to do more research about this, but there seems to be some sort of a conclusion that there is a level of risk. And the example that comes to mind is if we have a parent using a vape device with a toddler or baby in their hand, there's probably a harmful exposure to these chemicals, including nicotine, for the young child. So let's now look at some more long-term health risks, and definitely because vaping devices are so new, a lot of it is still under ongoing investigation. So what we do know is that nicotine is a very addictive substance. Nicotine in most e-cigarettes is a substance that takes about 10 to 15 seconds to reach the brain, and the effects are short-lasting, so 30 to 60 minutes. There's a production of epinephrine, meaning there's sort of an increase in the heart rate and blood pressure, but in the brain, there's a trigger of specific receptors that have a cascading effect on other hormones, including our pleasure hormone, dopamine, and some feel-good and calming hormones that play very important roles. And it's no surprise that nicotine is so addictive when we know how quickly it acts and how high it can peak our dopamine levels in the brain. And so we say that nicotine is more addictive than things like alcohol and cannabis, and similar to cocaine. So long-term effects, we mostly know from research of giving nicotine to animals in animal studies. And what we are starting to understand is that nicotine does produce persistent changes in the brain. So if we give nicotine to a young person or a young rat, for example, we will see differences in how the brain develops long-term. And what we think is happening is that we are sort of increasing this risk for future drug addiction, including obviously nicotine, but other substances. We also are seeing impairments in capacity to pay attention and to use your working memory longer term, and in association with some mood disorders and potentially impulse control. So definitely nicotine, when young people are using it, can have some long-lasting effects. Dr. Al-Hamdani has pointed to this. There are associations between vaping and other substances, and many papers have been put out looking at this. And so, you know, I get the question, is nicotine vaping a gateway behavior for other substance use, but we can at least say that young people who vape have much stronger statistical chances of either currently using other substances or later on moving on to using other forms of nicotine or tobacco, marijuana, and alcohol and other drugs. And so, let's see. Yes, I want to talk just for a minute about the difference between nicotine short-term effects and then withdrawal. Sorry for this. So nicotine, I mentioned, is a short-acting substance, and so it increases alertness, reduces appetite, brings your heart to beat faster very short-term. One thing that I see in my clinic is that because it's pretty easy to get addicted to nicotine, when you stop using it and you're a young person, you can have withdrawal symptoms. And these withdrawal symptoms in the box here on the right can be quite unpleasant and interfere with a lot of things that young people are expected to do, going to school, doing schoolwork, playing sports. And so this can definitely be an obstacle for cessation, just like it would be with young people using traditional cigarettes. And we know that withdrawal symptoms can happen very quickly, only a few hours after the last use of a vaping device, and that symptoms can peak and last for several days, sometimes weeks. So, I mentioned nicotine vaping and THC or THC vaping. I put some brain images here just to show that there are some common pathways between those two substances and how they affect the brain. And so it does become more complicated from a cessation point of view when young people are using both of those substances, because the brain gets a little bit confused. What's giving me pleasure? Is it the nicotine? Is it the THC? Is it a mix of both? And so it can be more difficult to stop using one or the other or both if we're using them together. And it can also increase the severity of withdrawal symptoms. So, I'll end with this, and just to say that there are all sorts of other proposed health risks when it comes to vaping. And really, as I mentioned, it very much depends on which type of vaping devices, how much are we using it, and how long will we be using them in time. But we think definitely from some clinical studies that are out there that there are risks for the lungs and lung health, short, medium, long term, especially for people with fragile lung, like lungs with asthma or people with COPD. We think definitely that the chemicals contained in the aerosols can bring an increased cardiovascular risk and heart disease. There definitely probably will be a significant cancer risk that we will more likely see with time, just because of this kind of inflammatory response that these chemicals bring to some of our lung cells and our heart cells and body cells. And then finally, some oral health effects, and that could be tied to some of the flavoring agents or bring increased bacteria in the mouth, so on and so forth. So we need more research to understand this, but we're definitely at the point of thinking that there are significant health effects related to vaping, both short and long term.
Wonderful.
All right,
Thank you so much. Thank you. Thanks, Dr. Chadi. That was a very great overview of the health risks that we're seeing, the questions left that unknown that we need more research to address. And we're very grateful for your clinical expertise in helping us understand this issue a bit better. So we have a lot of questions coming in right now. I wanted to ask a few in detail before we get to the audience questions. But I will say first, there's been a lot of questions about the slides and a recording available. So we are recording this presentation. We will make it available to participants within the coming week or so. So you'll have a link to both the presentation slides as well as the recording after the fact. We'll do it as fast as possible. My first question is to Dr. Chadi. You mentioned that the 95% less harmful, and we often hear this statistic being thrown around to speak to the benefits of vaping. Can we really give estimates of quantitative risk at this point based on the scientific evidence? And what are your thoughts on these statements about 95% less harmful? Do they hold merit? And are we able to actually put a numerical figure on harm at this point?
Thank you for asking, Leslie. As I mentioned in my first slide, there's such a wide range of vaping products, and there are so many variations in the liquids themselves that it's very tricky to put a number. We're not really comparing apples and apples when we're saying vape versus cigarette. and I'll focus on youth just for the sake of this answer. Young people who vape will sometimes use a ton of those vaping devices. I have young people coming to my clinic telling me I use 2 or 3 pods a day. Very rare to see a young person using 2, 4, 6 packs of cigarettes a day. So, you know, new patterns of nicotine addiction. So they get hooked up to the substance, but then, you know, all those chemicals that come with, it's hard to say a number. I think the 95% probably comes from maybe 1 or a few studies out there looking at earlier versions of e-cigarette devices. We have to be careful. We have to look at emerging evidence, and we have to think of what young people are putting in their e-cigarettes and how they're even using the device. So very slippery. And I would say that we're not ready to use a clear number to say. There probably is some significant harm reduction potential using e-cigarettes for older adults who are already smokers, but focusing today on sort of the youth vaping question, we have to steer away from this message that can be quite misleading for young people, you know, thinking, oh, well, you know, it's so much healthier than smoking, what's the harm? Which is really not the right message we want to be sending.
Great, that's a great response. Thank you very much. I wanted to ask about this controversial issue of vaping as a gateway or initiation to tobacco use. So, Dr. Al-Hamdani, your research findings indicate about 27% of young vapers with a history of tobacco use then initiated smoking after they started vaping. Does this align with the literature elsewhere on the subject? And what about these young people who are vaping who didn't have a history of tobacco use beforehand? Are they initiating smoking cigarettes after vape use?
There's a substantial body of evidence that have demonstrated the link between vaping and smoking initiation. Youth non-vapers have 4 to 5 times higher odds of becoming smokers in comparison to their non-vaping counterparts. And there's also there are also a number of studies that have demonstrated that between 20 to 22% of youth smoking is accounted for by preceding vaping behavior. So yes, the relationship has been demonstrated quite well. There's even a couple of studies that have demonstrated that higher vaping frequency is associated with higher smoking frequency later on. So what we found in this study is certainly in line with that.
Perfect. Thanks very much. Let's talk about pricing. Dr. Al-Hamdani, you mentioned pricing and taxation being a really important policy measure. How accessible and affordable are these products for young people? And given that the federal government has announced some intentions to implement a vape tax in 2022, what considerations do we need to keep in mind? And what can we learn from tobacco control in this regard?
Vaping is very cheap. We've found that the average regular youth and young adult vapor in the sample of 3,000 participants spends under $20 a week on their vaping devices. If we take the higher end of the spectrum of those users, so let's say those that use about 7 pods per week, and we'll find that they spend, let's say, about $35 to $40 per week. If you take a smoker who smokes a pack of cigarettes a day, that would be at least $120 to $140 per week. So if you were to implement a 100% tax increase on vaping products tomorrow, a year from now, you'll start seeing reductions in vaping rates without any negative consequences. And let's remember that in tobacco control, the #1 policy lever that reduced smoking is taxation, and it had the added benefit of increased government revenue without any increases in legal market activity, and research has clearly demonstrated that. And there's also emerging evidence that demonstrates that there's a lower intentions for buying and using vaping devices if you were to increase their prices through taxation. And this is important, particularly for youth who tend to be more price sensitive. So if you increase taxation by a certain percentage, you'll start seeing a stronger reduction in vaping rates amongst youth, particularly in comparison to adults, and that's simply because of affordability, the point of affordability. So taxation, definitely a no-brainer, and it needs to get done.
Wonderful. Dr. Chad, anything to add to that from what you're seeing from young people vaping in practice?
I mean, I think all of those are great points. We're really seeing more and more solid research pointing towards the advantage of having strict taxation and controls on nicotine concentrations and flavors, all things that my colleague mentioned earlier. But I think, you know, we're focusing very much on youth today. The question that I always get asked is like, okay, well, that's all good, but then if we do want to use vaping devices for some form of harm reduction, where do we find this kind of middle ground? And I think that really we've skewed towards being very permissive with vaping devices. They just entered the market, and the marketing example is so striking. You know, when you have like person-sized ads in the subway with flashy colors, clearly we're not thinking of protecting youth, and we're starting to really get back to something that's more controlled. And I think we have to continue to think very carefully on how far we want to swing to restricting and controlling. Black market is always something we fear, and you know, it's easy to order things online now from across the border, across the world. So it's going to be to find that right balance, not over-regulating, not necessarily overtaxing in comparison to traditional tobacco products. But I think that we're not quite there yet, and research is supporting that a lot more now, with some papers coming from different states in the U.S. that have, you know, instated different regulations and have seen, you know, beneficial effects on youth vaping rates, while still, you know, keeping this reduction in youth smoking rates and allowing adults to access vaping products if it's something that can be helpful for them. So it's a tricky balancing act. It's a very complex public health question when we think about vaping. And as a pediatrician, it's easy to get lost and only focus on kids, but we need to keep that bigger picture in mind, because it is definitely part of the discussion. And my teens have parents, so I'm going to be asked those questions.
Thank you for that insight. It's definitely a challenge to strike a balance between harm reduction and precautionary principle and protecting young people. Dr. Mo, your point about ease of access and people spending $30 a week on these products, it's clearly very accessible. And for someone who works a minimum wage job, it's a few hours of work. So it's not hard to be purchasing these on a regular basis. So I'm really grateful we have those numbers now, just to point how important pricing might be.
And we're far away from having vaping close to the price point of you know, tobacco products. And the reason I said 100% is if you implement 100% on $30 worth of vaping, you'll be at $60 per week, which is still half as much as the cost of tobacco. So it will be well under the price point and still available as a, you know, a product to try to quit smoking for adults who wish to do so.
There's still a possibility of substitution with a lesser value. That makes sense. Your research focused a lot on flavors, and given what we know about flavors and preferences, what should we be doing to regulate flavors in Canada? We have different approaches across the country, different provinces making different exemptions for various flavors, or where certain flavors are sold. What do you recommend going forward to address this crisis?
Yeah, so we have found our study that there are certain flavors that are particularly popular amongst youth and young adults, and in the following order: they were berries, followed by mint and menthol, then mango, and confectionery flavors. So these flavors are particularly problematic both at initiation and at maintenance. So any kind of flavor ban measure needs to ensure that those are not included as an exemption. And the gold standard would be to implement a full flavor ban that exempts only tobacco flavors. As shown in slide number 24 that I displayed earlier, tobacco is much less preferred, and it is an adult-based product. And by restricting the flavors only to tobacco, you're essentially ensuring that adult smokers who want to use vaping as a smoking cessation aid have the option of a tobacco flavored vaping product rather than a tobacco flavored tobacco.
Great, good point. I'm going to move over to the audience questions now. And we had one question come in early, so those who are early get priority. So thank you to Les Hagen, our colleague, who asked about menthol exemptions. What are your thoughts on regulators exempting mint and menthol, given that we know this is a very favorable and highly preferred flavor among Canadian youth, and what we've seen in the US about shifts to menthol among young users since that exemption took place? What are your thoughts?
The first thing I'm going to say is mint and menthol are youth-oriented flavors. The data speaks for itself. You saw the counts, and what's even more concerning and quite truthfully came to my mind once I started sketching those bar graphs is how mint and menthol is the only flavor that increases in preference between initiation and maintenance, and quite significantly. So exempting mint and menthol in a flavor ban is essentially exempting the second most preferred flavor by young users, and it goes against the evidence. And that applies also to berries, mango, and confectionery, which should not be exempted.
Okay, good to know. Thank you. A lot of questions coming in about adolescent brain development. Dr. Chadi, what can you say about this in particular? Are we seeing more mental health issues as a result of young people vaping? Some people are saying it helps with their mental health, especially in the time of COVID. And then we're getting some questions about ADHD and other substances being more likely to be used as a result of vaping. You can speak in more detail to that.
Of course. Yeah, there's a lot to say here. So what we know is definitely that substance use, like mental health, is multifactorial, right? There are many, many risk factors that come into play. It's rare that we can point the finger and say this caused this when it comes to substance use and mental health. Same with brain development, right? Your brain develops and certain things happen, and that can impact how it changes and shifts with time. Definitely what we're knowing is from those imaging studies and those animal studies and some of the human studies coming out is that certain specific parts of the brain are impacted by early and regular use of substances like nicotine and cannabis. And I mentioned in my talk some of those key areas of the brain, those involved with emotional processing or rational thinking tend to be a little bit more impacted. So, you know, there's a couple of things happening. So this fragility in terms of one substance potentially, sensitizing the brain to the pleasurable effects of all substances. So young people trying to seek that effect if it's something they get early on in life, and then the downstream effects of a lot of dopamine and these dopamine surges potentially cascading on other hormones that can wreak havoc in the body's homeostasis, right? So the body's ability to maintain peace, calm, and stability, which is so important to all sorts of our functions. So when you try to think about how do you tackle that with young people, and how do you think about vaping and mental health, a lot of teens come to me and say, well, vaping makes me feel better. Yes, in the moment, I will agree, there's dopamine being produced. It's going to be hard to argue that you don't get this euphoric state after vaping. But if you dig a little bit deeper, you'll know that there's a swing effect after that. So nicotine is very short acting. Cannabis is a little bit longer acting, but still, after a few minutes, a few hours, you're not going to feel good. You're not going to cure or help your anxiety or depression. Chances are your sleep quality is going to go down. Your motivation is going to go down. There are going to be effects on your appetite. Your regular healthy routine is going to be impacted by your use. So your protective factors in your everyday life and your environment may be impacted. And then you're not helping the problem. You're potentially sensitizing your brain to all sorts of different things. So I don't see a way where vaping can be helpful or healthy and can probably bring in all sorts of new risk factors the use of the substance itself and its impact on other behaviors, right? So this is what we're starting to learn. And you asked about ADHD. What we know from the science about ADHD, because I've looked at this through the literature and written about this as well, is that young people with uncontrolled ADHD are more likely to use substances. It might be that they're seeking sensations, they're more impulsive, they maybe are trying to self-medicate in some way. But again, it's not going to make their ADHD better. It's probably going to give them euphoria at some point and then, you know, cause all sorts of other problems down the line. There is an advantage to properly addressing and treating ADHD among young people who don't use any substances yet, or even those who have started yet. Because if you have a better control on your impulsivity and your inattention, it may be that you're going to have a better capacity to control addictive behaviors like vaping and use of other substances. So these are complex questions to have, and there's definitely great need among healthcare professionals to understand this better. There's also quite a bit of a deal of stigma around this, right? So young people who use vaping devices or substances don't always get access to the medications that could help their ADHD. So some of those things need to be clarified, and you know, there's a need for better psychosocial support through primary care and communities. I can go on, so on and so forth. But all that to say that vaping is tied to mental health in many different ways, and we're looking at something that's multifactorial.
Great. Thank you for that really comprehensive answer. Some other questions that seem to be really percolating up relate to Dr. Mo, your discussion about side effects. So you asked participants in this survey about side effects they've experienced with vaping. Can you elaborate on that?
Sure. Yeah. So we've seen a range of reported effects. So we basically asked them, have you ever experienced any negative effects from vaping? And if so, elaborate. And respiratory symptoms that range from shortness of breath and having difficulty breathing when someone is running and what have you, things on that domain clearly came up as a very dominant category. And to Dr. Chadi's point about the love-hate relationship with nicotine, nicotine's negative effects of nicotine in terms of withdrawal and nausea, and all of those negative effects were also another category that came up. And there's also general physical symptoms that came up as problematic. And when you're looking at, it was about 50% of the participants reporting these are users that have used the product anywhere between 1 to less than 10 years for sure. The product, within that kind of span, to see those effects already materializing, it's concerning, but yet not surprising given the high nicotine concentration choices that they opt for.
Mm-hmm. And that leads into another question that's come in, is that what are the motivations around young people jumping right to these high nicotine products? They're not really starting off with the lower dose, but going right to the max. What do we know about that?
Because if you ask youth, and we've done that, if you ask youth, what do you like the most about vaping, nicotine rush comes on top. Even if you ask it as an open-ended question, the range of responses that you will get, which all mean the same thing: feeling heady, getting a head rush, getting buzzed, nicotine buzz, nicotine rush. And nicotine rush specifically is a term that definitely comes up. So it is their motive to, for using e-cigarettes. And what we know about addictions in general is once you use a high if it's different to use a high concentration of a psychoactive substance versus a lower concentration. This is why sometimes, for instance, individuals who are addicted to certain products, if they get their hands on something that, like Oxycontin, they will try to adulterate it. They will try to, basically break it. They try to get a higher yield or concentration of it because and they will try to administer it through a route that gets the maximum amount of, effect, and that quick dopamine rush that a user gets from a high concentration of a product is very, very different from getting it from a lower concentration product. So they do whatever they can in order to in order to attain that. And that's another reason why pods versus other types of devices are particularly more addictive, because aside from the nicotine concentration, the type of nicotine that is used, as Dr. Chadi has already alluded to, it results in a higher yield of the product or higher absorption of the product. So the higher the absorption, the higher the concentration, the better than nicotine rush. But also on the flip side, the more the problems down the line.
Wonderful.
Yeah, and maybe I'll just quickly jump on this, just to share a reflection. When you listen at what we just heard, this is so different from a harm reduction lens, right? We're thinking of young people trying to get the highest buzz possible from a very slick and high-tech little device that will allow them to do that. And this is precisely why we need proper regulation. We need products to be regulated in a way that they will, in fact, be harm reduction strategies and not, targeted towards youth, where they can just use them for a pleasurable experience that, as we've seen, doesn't bring many benefits, but a lot of short and longer term risks.
Mm-hmm. Your comment about it being kind of a party drug now was very eye-opening. I was totally unaware that that's how it was being used, but it makes sense given the head rush and the high that people are able to get from these devices. So thank you for sharing that insight. We have so many questions coming in. We're going to take one more, and then I wanted to wrap up with a few next steps. But given we're living in a pandemic and our life has changed so much, Dr. Chadi, the question is to you. What do we know about vaping and COVID? Is there a connection between the two? What have you seen in clinical practice?
Yeah, I've been very curious to hear more about this and follow the research. So some things are obvious. If young people are using vape devices together, sharing them, not wearing masks, well, of course, they're at higher risk of infecting each other through vaping. And I've heard of an outbreak in a school in Quebec that was largely due to young people sharing vape devices among friends. So that's one thing. There isn't much research looking at what happens to someone who vapes versus doesn't vape in terms of COVID-19 severity or disease, complications. So we're still trying to understand that better, and some of the research work that I'm doing is looking at that. In terms of how has COVID impacted youth use of vaping devices, it seems that there may be, in some circumstances, fewer opportunities to use or start using vape devices, maybe reduced access, people are more confined to their homes. So some slight decreases in rates of vaping have been reported by some national surveys that look at pre-post COVID-19 outbreaks, but some sources also suggest that some people with for example mental health problems or distress related to the pandemic may be using more of the vaping devices or in a more problematic way. We know that it's not all young people who vape who are going to be regular vapers, but among those who do vape more, and they're more likely to get the complications and the long-term problems. So we'll have to think about the COVID-19 teen mental health problem and distress and not separate that from potential increases or increase in problematic rates of vaping device use.
Wonderful. Thank you for that. So I want to conclude by saying thank you so much to our presenters. It was very insightful and valuable data and information you've shared with us. What are the next steps? So we will see a nicotine cap in Canada coming this year, and we're very grateful for that. This will address some of the issues we have with high nicotine use among young people. The budget last month also announced intentions to adopt a vape tax. And then we have a remaining policy issue left on the table of flavors. So you'll also have access to Dr. Al-Hamdani's new report, the Pan-Canadian Research on Youth and Young Adult Motivations for Vaping, funded by Heart and Stroke and other partners. And then Heart and Stroke is also launching our e-cigarettes in Canada policy statement today, which is revised and has a really good reflection on all of the evidence to date and the policy recommendations that can be used all across Canada at all levels of government. So with that, we're ending on time, and I want to say thank you again to our speakers and to all of you for attending. We had too many questions come in. We will try and answer them somehow and get you the information you need. And again, you'll have the slide decks and this webinar available in the coming week. Thanks for spending time with us, and thanks for your interest in this important topic. Take care. Stay safe.